Chapter 32 Serious Mental Illness. Serious mental illness is defined as a group of psychiatric conditions, most of which are primarily biological in origin, that can significantly affect functioning and one's quality of life, especially if they go untreated. The U.S. organizations use the abbreviation SMI, and 4.6% of all adults in the United States have a serious mental illness. There could be many different conditions that qualify as a serious mental illness, everything from mood disorders, personality disorders, psychotic disorders, and the subtypes of schizophrenia. In our first case study, Marcus, 23, has been stigmatized by all his young adult life. Ever since at the age of 16, he began displaying early schizoid symptoms. Teased and bullied in high school and one disastrous semester at college, he's tried a long string of fast food jobs, only to be fired because of a crippling social anxiety in such a fast-paced setting. He is currently homeless after becoming physically aggressive and frightening his aging parents. In the case of older adults with serious mental illness, before deinstitutionalization, psychiatric hospitals were long-term residences. Patients became dependent on services and structure and were unable to function independently. Now the current challenges are more inadequate housing, inadequate diet, and more physical toll, along with the medication-induced conditions. Back in the olden times, there were the long-term psychiatric institutions you may see in some horror movies. And there's been a lot of progress in recent years about bringing this treatment more into the outpatient setting. The more independent we can keep these patients, the better for them and for the healthcare system. Keeping them as independent as possible while still controlling their symptoms. In the case of younger adults with serious mental illness, they may have limited experience with formal treatment, an experienced series of disjointed short-term hospitalizations, cycles of quick treatment, brief recovery, non-adherence, and relapse, hospitals that often fail to recognize the need for treatment, and additional problems such as increased frequency of relapse, legal difficulties, homelessness, substance use, unemployment, and poor long-term prognosis. In the development of serious mental illnesses, there is similarity to chronic physical illnesses, where the original problem develops, the original problem increases, and the coping erodes. This causes new problems to develop, such as loss of social skills, social interactions that provoke more anxiety, withdrawal leads to isolation and lack of support, and coping and functioning that continue to deteriorate. In the case of rehabilitation versus recovery, rehabilitation focuses on managing the patient's deficits, helping them learn to live with their illness, while recovery focuses on client empowerment and strengths, achieving goals of the client's choosing, and leading an increasingly productive and meaningful lives supported by outside external supports, including NAMI and other healthcare factors. The recovery model is patient-centered, client-centered, and is hopeful and empowering. It emphasizes the person in the future rather than the illness in the present, and involves an active partnership between the patient and their healthcare providers. Continuing with our case study, after an anxious outburst outside of a popular restaurant, Marcus is taken by police for a mandatory 3-day psych hospitalization for the third time in 6 weeks. Fortunately for Marcus, due to a rise in the tourist industry in the city council has developed a 3 strikes program for its mentally ill homeless population. All 3 mandatory hospitalizations are given a caseworker who works with the patients to help find more long-term rehabilitation options, as opposed to repeated incarcerations. Many of the issues of those confronting those with a serious mental illness include establishing a meaningful life, dealing with other comorbid conditions, other physical disorders, suicide, and substance abuse. Other issues are social problems, a stigmatization of the mental illness. There's isolation and loneliness, victimization, economic challenges, unemployment and poverty, housing instability, and being a caregiver burden. The treatment issues these patients deal with, a major factor would be anosognosia, which is an inability to recognize one's own illness, and the fact that they don't realize that they're sick. It results in non-adherence to treatment, as well as dealing with medication side effects, treatment inadequacy, residual symptoms, and frequent relapse. Marcus, from our case study, his caseworker finds him a bed in a halfway house for men with serious mental illness. During intake, the admissions nurse learns from Marcus that he initially did well on his medications when he was first diagnosed. But then, Marcus says, I started doing good and I figured out that I was cured. I didn't need those drugs and their side effects anymore. I don't need them now either. I'm not ill. I'm just pissed off. People are out to get me. Like in high school, society never changes. Part of Marcus's illness, then, is an inability to recognize that he is ill. This is called A. Relapse, B. Anosognosia, C. Non-adherence, or D. Residual symptoms. And that answer is going to be B. Anosognosia. And it's a symptomatic inability to recognize that the illness is an illness. Relapse is that cycle of getting better only to fall into the cycle of severe mental illness and symptoms again. And sometimes this is due in part to non-adherence or non-cooperation with treatment. Other serious mental illness resources include research and educational support, comprehensive community treatment, and community services and programs. Those community services and programs can take everything from case management, day programs, group and individual psychotherapy, including family therapy, psychoeducation, support groups, and even crisis intervention services. Other community services and programs could include emergency psychiatric services, housing services, partial hospitalization programs, intensive outpatient programs, community outreach programs, multi-service centers, and substance use treatment. Evidence-based treatment approaches would include assertive community treatment, where the consumer works with a multidisciplinary team to receive a range of services as opposed to going to multiple agencies. They may also receive cognitive behavioral therapy that focuses on patterns of thinking and self-talk, along with cognitive enhancement therapy, which is a computer-based drills and exercises to strengthen brain function. Evidence-based treatment and approaches could also take things like family support and partnerships, including NAMI's family-to-family program, social skills training, and vocational rehabilitation and related services. NAMI's family-to-family program focuses on understanding serious mental illness, also working with the patient on coping skills and the recovering process. NAMI meetings and support groups are specific to various serious mental illnesses. For example, the Depression and Bipolar Support Alliance serves as an excellent source of support for those practical guidance of primary consumers and secondary consumers, their significant others and close family. Vocational rehabilitation and related services work on the clubhouse model, and the consumers run the programming. The supported employment model, on the other hand, provides financial incentives to employers for hiring these patients. They also have rapid placement and job preferred by the patient, continuing individualized support on the job, and an integration of mental health and employment services. Other treatment approaches could include court-involved intervention, including psychiatric advance directives, guardianship, consumer-run programs, peer support, and the implementation of technology and exercise. Marcus's new therapist helps him learn to focus on identifying his own distorted thinking and using self-talk to get control of the situation and turn his thinking around. This treatment is popularly referred to as A. Assertive community treatment, B. Cognitive enhancement therapy, C. Cognitive behavioral therapy, or D. NAMI, the National Alliance on Mental Illness. And that answer here is going to be C. Cognitive behavioral therapy. That involves helping the patient focus on A. the underlying distorted thinking, and using self-talk to come to a more realistic frame of mind. In the nursing care of patients with serious mental illness, assessment strategies may be used to identify intentional risk, unintentional risk, depression or hopelessness, anxiety, signs of impending relapse, physical health problems, comorbid illnesses, and treatment non-adherence. Nursing diagnoses can include impaired verbal communication, impaired socialization, social isolation, non-adherence, chronic low self-esteem, and caregiver stress. Nursing care could include intervention strategies that involve patient in goal setting and treatment plan, and also emphasize quality of life over symptoms. They help to sustain therapeutic relationships, focus on coping with their current issues over the past, encourage reality testing, teach how to respond to stigma, and promote social skills and support groups. Current issues affecting individuals with serious mental illness include outpatient commitment, criminal offenses and incarceration, deinstitutionalization versus transinstitutionalization, and inadequate access to care. The practice of outpatient commitment is controversial. On the one hand, individuals who do not recognize having a mental illness are provided with health care and potentially a better quality of life. They're allowed maximum freedom and are able to live in the community and avoid institutionalization. On the other hand, this approach is paternalistic and at odds with the recovery model of healthcare. For an audience response question, James Holmes was the shooter at the Batman premiere in Aurora, Colorado in 2012. Do you think this incident contributes to the stigma of mental illness in our society? That be A, yes, B, no, or C, not sure. And in this case, the answers could vary. There's not necessarily a right or wrong answer here. There's been mental illness for a long, long time. One of the guys that shot Ronald Reagan in the 80s was doing it to impress Jodie Foster. It's unfortunately, these are not new issues. And it's always had a stigma. I actually do feel like we're making progress in society and moving forward to reduce some of this stigma. But I also have a feeling that it's always going to be present as well. And for our last audience response question, Marcus responds to cognitive behavioral therapy and is recommended for a day program that incorporates the Clubhouse model. This focus of the Clubhouse model of treatment is to stabilizing through peer-to-peer counseling, conducting research studies within the community, provide an opportunity to build job skills, or intensive treatment. And that answer is going to be C. They provide day programs that may use a Clubhouse model, in which the clients run through a programming through peers. Client-run businesses such as a coffee shop or housekeeping service teach all the members to perform a job in the business, as well as different aspects of running a business. Some programs have led to the supported employment model, which has been shown to be more effective in helping individuals with serious mental illness achieve employment. And that's going to be your major hurdle, is getting them out and functioning within society. We've got away from those psychiatric institutions of 100 years ago, but at the same time, keeping them active participants and living a full, healthy life is going to be a major challenge. But anyway, that's all we've got for this chapter. I'll see you in the next slides.